Good evening, everyone. I am here with a presentation on a rare case. The case was courtesy of Dr. Ravi sir. He was generous enough to lend us all the images and videos related to the case. A 24-year-old priming gravida had come for ultrasound for the very first time in her mid trimester. She has had no previous scanning done and her marriage was consanguineous. I will play you a video loop. I request you to watch the entire video before we move on to analyzing the findings. As you must have observed that many facial abnormalities can be seen in this fetus, like the presence of a prominent midline proboscis. The eyes were also close to each other, suggesting hypotelorism. The ears were not seen in their normal position. Instead, they were low set and medially displaced and were seen as an extra layer of soft tissue in the neck. In this midline plane, you can see the prominent proboscis very well, but you can also observe that the mandible is absent, suggesting agnathia. These are the still images of the same fetus. Here, you can beautifully see the prominent proboscis. You can see the low set and medially displaced ears. These are the 3D images of the fetus. In this sagittal view, you can see the prominent proboscis and also note the absence of the mandible. Also can be noted here is the hypoplasia of the malar region or the cheeks. These are the post-abortus images of the fetus. You can see a mid-facial protuberance containing cranially displaced nose and a very small oral orifice. The orbits are caudally displaced with down-slanting palpebral fissures and hypotelorism is also seen. The ears are horizontally and medially displaced, and the mandible is also absent, which correlated with our ultrasound findings. So, this was a case of otocephaly. Otocephaly is a rare lethal congenital disorder that occurs due to defect in the blastogenesis phase. This causes the first brachial arch to fail to develop into the mandible, parts of ear, and anterior two-thirds of the tongue. It was first described by Kreckering in 1717. Its prevalence is estimated to be less than 1 in 70,000 births. So the characteristic features of otocephaly are microstomia, which is underdevelopment of oral orifice, and this leads to presence of polyhydramnios. Aglossia, which is hypoplasia or absence of tongue. Agnathia, which is hypoplasia or absence of mandible. Melosia or synosia, which is ventral or horizontal positioning of the ears with or without midline fusion. The syndrome complex of otocephaly is divided into four types. The first type is isolated agnathia. The second type is agnathia along with holoprosencephaly. The third type is agnathia with situs inversus and visceral anomalies. The fourth type is a combination of the previous three types, which is agnathia, holoprosencephaly, situs inversus, and other visceral anomalies. The etiology of otocephaly is under research, and it is speculated that some teratogenic agents and drugs have a role in its etiopathogenesis, like salicylates, amidopyrin, and theophylline. Most of the cases of otocephaly are sporadic, but few familial cases are known. This suggests a genetic background to the disease. Recently, it has been established that otocephaly can be caused by new heterozygous or biallelic mutations in the PRRX1 gene. The other associated anomalies which can be seen in otocephaly are corpus callosum dysgenesis, pituitary gland absence or hypoplasia or pituitary axis insufficiency, atrasia of the third ventricle, midline proboscis, cleft lip or cleft palate, cephalocele, thyroid hypoplasia, tracheoesophageal fistula, renal ectopia, adrenal hypoplasia, neural tube defects, vertebral and rib abnormalities. The differential diagnosis for the findings in otocephaly can be Treacher-Cullen syndrome, Goldenhar syndrome, Mobius syndrome, Pierre-Robin sequence, or Nagar syndrome. So, to conclude the presentation, otocephaly is incompatible with life. It is very important to diagnose it as early as possible in the antenatal scans when mandible and ear are abnormally placed. The first trimester screening, along with demonstration of fetal profile for detecting the facial anomalies and presence of polyhydramnios with use of 3D ultrasound, will help us to make the diagnosis of otocephaly. I thank you all for your patient listening. Have a good night.